We do have members from the Canadian Association of Physician Assistants. Please go ahead. You have 7 minutes, and would appreciate if you can state your name for Hansard.
Hi, my name is Leslie St. Jacques. I'm the president of the Canadian Association of Physician Assistants. And I have my colleagues Sahand and Safi, who's the Ontario director for CAPA, who will also present with me. We'll be sharing our time. So thank you so much, Mr. Chair, for the opportunity to speak today. And we'd also like to extend our gratitude to the Ontario government and the Minister of Health for recognizing the valuable contribution of PAs and the need for regulation. I'm calling in from my office at the ICU at the Toronto Western Hospital, where I work as a PA in neurosurgery and am the co-lead for PAs at UHN. Bill 283, the amendment of the Medicine Act, is welcome yet long-awaited announcement. Regulation of health professionals is at its core about public safety, ensuring that health professionals provide competent, ethical care. The introduction of physician assistants into the medical system in Ontario began in 2006. At this time, we have over 700 PAs working across Canada, with more than 500 of them in Ontario. And since our Canadian physician assistant education programs have been training physician assistants in the medical model, we've had 975 graduates. Physician assistants may provide care in all medical settings, including families, doctors' offices, long-term care, emergency departments, surgical specialties, and oncology. PAs are working on the front lines every day. Many PAs have joined COVID teams in ICUs and also are caring for COVID patients on the wards. They're assessing and treating patients in emergency departments, and they continue to maintain virtual clinics or in-person clinics to ensure ongoing care. We've reduced wait times at the family doctor's office, allowing for more same-day appointments to be offered. In the emergency department, patients are seen more quickly, reducing the number of people who leave without being seen. We also improve access to care in rural and remote communities. When we assist in surgery and in perioperative care, we provide consistency and improved flow through the hospital. And we also act as a contact for patients after they've gone home. Increasing access to high quality care is what PAs do. Regulation will create efficiencies and improve safety for the people of Ontario, supporting accountability and a standard of excellence in medical care, making sure that the title of physician assistant is meaningful, used only by those who hold the appropriate degree, and uphold the high standards set by and for our profession. Regulation also provides assurance to our colleagues and patients and promotes integration within the healthcare system. It is my pleasure now to share the floor with CAPA's Ontario Director, Sahand and Safi.
Thank you, Leslie. Mr. Chair and committee members, my name is Sahand and Safi. In addition to my role as the Ontario Director for CAPA, I work as a PA in the emergency department alongside Leslie, who also works at the University Health Network. I'm also actively involved as a PA educator at the McMaster University and the University of Toronto PA programs. I would like to echo Leslie's remarks. Although the introduction of Bill 283 and the amendment to the Medicine Act 1991 is welcome, it is long overdue. PAs have been serving Ontarians for approximately 15 years, and in this time, we've had an excellent track record as a profession. In addition to delivering high-quality patient care, research shows that including PAs as part of a collaborative healthcare team improves efficiency and delivers higher levels of service to patients, all while reducing costs for the healthcare system. Here in Ontario, PAs are currently functioning through the delegation of controlled acts, and particularly via the use of medical directives, which is essentially an outline of the PA's scope of practice, or simply the things that we can and cannot do. Unfortunately, it is quite a lengthy process to create medical directives for PAs, given our broad and variable scope of practice, and the development and implementation of directives often acts as a barrier to PA utilization and integration. Regulation will allow PAs the ability to be able to practice without these complex medical directives, as it will provide role clarity and guidance, allowing us to work to our full scope of practice. And as Leslie mentioned, ultimately allow for better integration of PAs into our system and when working with other healthcare providers. For example, Currently, PAs working in acute care, including myself, are unable to speak to poison control because their staff are unable to speak to unregulated healthcare providers when providing guidance on how to manage a patient with a toxicologic emergency. PAs who are trained to extend the services of the physicians with whom they work are also currently unable to sign outpatient prescriptions. These are prescriptions for the same medications that the PA may determine is needed to treat a patient's underlying medical issue, and the same medications that we can prescribe via our medical directives in the hospital. Many PAs have also expressed frustrations when assessing and examining a patient after a workplace injury and their subsequent inability to sign any legal or government forms due to the lack of regulation. These examples all impact patient care by limiting PAs from performing the very tasks that they have been trained and deemed competent to perform. Furthermore, these are only a few of the very many examples of how a lack of regulation acts as a hindrance to providing optimal patient care. Undoubtedly, regulation will help break down barriers and will provide PAs with more credibility amongst our colleagues in the healthcare system. Most importantly, however, there is a tremendous benefit for patients and for government in regulating PAs, as it will ensure we as medical professionals are being upheld to the highest of standards, and that PAs who perform many of the same tasks of the physicians with whom they work are practicing safely and effectively. We look forward to moving through this process quickly, establishing a timeline and finalizing the details of regulation with the College of Physicians and Surgeons of Ontario that maintains and optimizes our scope of practice so that we as a profession can achieve our full potential. We would like the government's support in ensuring that this work proceeds quickly. On behalf of all Ontario PAs, I want to thank the Minister of Health, the Government of Ontario, for moving this forward after a decade and a half of inertia. We hope that this committee and all parties will support the passage of this bill. Our patients will thank you for it. Thank you for your time.
In your view, would the proposed framework for regulations improve labor mobility for physicians' assistants in Canada? And either Leslie or Sahan can answer that.
Yeah, thank you, MPP McKenna, for your support. And I think it absolutely would. I think this is definitely the first step for us in moving towards that right direction. Obviously, there's some subsequent steps that need to happen when we start our work with the CPSO to determine how best to create a framework for PA regulation. But I'm confident that the proposals that are in this bill will allow us to work towards an optimal model to help PAs work to their full scope in Ontario.
My second question is for either of you. Recognizing that physician's assistants will continue to work under the supervision of a physician, do you see the need for an order to be explicitly noted?
I just wanted to say to the physician assistants who have talked to us today, thanks so much for all the work you're doing as well. I know it's been a very difficult time for everybody working in healthcare, so also to the Pedarthic group for all the work you're doing. And of course, Unifor, who's representing its members. But it is obviously a very difficult time for people. So as I understood it, and I'm not that familiar with what physician assistants do, because it's fairly new. I used to work in the Ministry of Health as a policy advisor, and I was responsible for regulating all of the, for working with all of the regulated health professions and those who wanted to be regulated at the time. But it was many years ago, which shows you how old I am. And I don't think we had physician assistants at the time. So my understanding is you have to have orders written down by the physicians. And I think that's what MPP McKenna's question was aimed at. Is that correct? You can tell us if it's not.
Yeah, so typically with the medical directives right now, in essence, that's what they are, is that there's a set of guidelines and pre-made orders essentially with the physicians that we're working with that says if a patient presents in a particular way, these are the things that we can and cannot do. I think this conversation is probably a complex one. I'm not sure that I could simplify it to yes, I think we need an order, or no, I think we don't. I think these will all probably be discussions that we have to have with the CPSO, but I think that I'm very clear in that all of the Ontario PAs look forward to continuing to work with our physician colleagues and determining how best to be utilized, I think, at the practice level with those physicians is the optimal model. Now, whether that's via order or whether we determine that there's some other process that we can create with the CPSO, I think that's probably the way forward. I hope that answers your question.
So my next question will be, do you have any additional comments on the legislation and what is envisioned for the regulation of this profession?
Well, we really appreciate this legislation being proposed and really looking forward to it coming to fruition, because it will make a very big difference in terms of efficacy of our workflow and the ability to provide care for patients. And especially in terms of title protection, we have some instances where people are represented as physician assistants when they actually are not, or job ads for physician assistants that clearly are not actually aware of what a physician assistant does. So this legislation will very much promote public safety and ensure that we are already setting standards for ourselves as a profession, and they are already criteria for certification, and we have a certification exam, but having regulation will allow us to go even further with that and to provide accountability. So I think we're well known already as physician assistants in Ontario, and this will help us to do our jobs better for the healthcare system. So thank you so much for putting this forward.
My next question is to the Association of Physician Assistants. In your view, will the proposed framework for regulation improve labor mobility for physicians assistants in Canada?
I think that because each province regulates PAs separately, or will regulate PAs separately, this will definitely help in terms of standardizing. However, our education is similar across Canada, so we are physician assistants able to work across Canada already. It just happens to be that the most PAs actually work in Ontario. More than 500 of us are here. Is that what you meant?
Well, in a sense, yes. But if you have any other recommendations to strengthen the bill, I would be quite happy to hear from you.
Sahand, go ahead.
Thank you, MPP Babakian. So from my perspective in Ontario, I think the proposal to amend the Medicine Act probably will work quite well in our favor, in that in other jurisdictions like Manitoba and New Brunswick and other provinces already in Canada, this is the framework that they use to regulate physician assistants, is that they've regulated them under their respective physician colleges, because we work so similarly with the physicians whom we work with. So I expect that should we start to work with the College of Physicians and Surgeons of Ontario, we probably don't need to recreate the wheel, and we can look at other jurisdictions where this has already been working very well. And I suspect that this will greatly improve the way that PAs are being utilized across the province.